Hi everyone, my name is Instructor Oliver and welcome to our video lesson today on Medicare as a secondary payer. Let's begin. What is a Medicare secondary payer? When an individual becomes eligible for Medicare, they can still use other insurance plans to lower their cost and receive access to more services. Medicare will normally act as a primary payer and cover most of their costs once they're enrolled in a benefit. Their other insurance plan will then act as a secondary payer and cover any remaining costs, such as coinsurance or copayments. Medicare can work with other insurance plans to cover their healthcare needs. When a member uses Medicare and another insurance plan together, each insurance covers part of the cost of their services. The insurance that pays first is called the primary payer. The insurance that picks up the remaining cost is the secondary payer. So an example would be if a member had an X-ray bill of $100, the bill would first be sent to their primary payer, who would pay the amount agreed upon by their plan. If the member's primary payer was Medicare, Medicare Part B would pay 80% of the cost and cover $80. Normally, the member would be responsible for the remaining $20. If they have a secondary payer, the secondary payer would pay the $20 instead. In some cases, the secondary payer might not pay all of the remaining costs. When this happens, the member will receive a bill for the amount left after the primary and secondary payers' coverage. For many Medicare beneficiaries, Medicare is always the primary payer. This means that unless the member is receiving a service that is not covered by Medicare, the bill will go to Medicare first. Why you might need a secondary payer. A secondary payer can help a member get even more coverage than offered by Medicare. If they have a health plan from their employer, they might have benefits that are not offered by Medicare. This can include dental visits, eye exams, and even fitness programs, and more. Secondary payer plans often come with their own monthly premium. They will pay this amount in addition to the standard Part B premium. In 2020, the standard premium was $140.60. However, even with this added cost, many people find their overall costs are lower since their out-of-pocket costs are covered by the secondary payer. Secondary payers are also useful if they have a long hospital or nursing facility stay. Medicare Part A will be their primary payer in this case. If their stay is longer than 60 days, though, there is a $352 coinsurance cost per day. A secondary payer could help cover this cost. Additionally, most secondary insurance offers coverage for prescription. This would mean that an individual wouldn't need a separate Medicare Part D plan. Depending on what plans are available in the member's area, this could lower their healthcare cost. What are common secondary payers for Medicare? There are a couple of common situations when a member might have a secondary payer alongside of Medicare. For example, if they still have insurance coverage from their job, military benefits, or another source, Medicare will be the primary payer and their other insurance would be the secondary payer. The rule for using Medicare with each type of insurance is a little different, and we're going to discuss this in the next slide. So here are some common scenarios explained. Let's review some of these common scenarios described on our slide. So, Medicare and employer-sponsored healthcare plans. If the member is over 76 years of age and eligible for Medicare, but hasn't yet retired, they can use Medicare along with their company's health plan. How Medicare works with their employer-sponsored plan depends on the size of the company. Medicare is generally the secondary payer if the employer has 20 or more employees. When an individual works for a company with fewer than 20 employees, Medicare will be the primary payer. The same rule applies to employer-sponsored coverage that they would get through a spouse. For example, let's say that the member's been getting health coverage through their spouse's job at a company with thousands of employees. When the member turns 65, they can keep using the plan provided by their spouse's employer. Medicare will be the secondary payer in this case because the spouse works for an employer with more than 20 employees. Medicare might also pay second sometimes, even if the company has fewer than 20 employees. This can happen if the company participates in what is known as a multi-employer plan with other companies or organizations. If any of those employers have more than 20 employees, Medicare will be the secondary employer. Medicare and COBRA. COBRA allows an individual to keep employer-sponsored health coverage after they leave a job. They can choose to keep their COBRA coverage for up to 36 months alongside Medicare to help cover expenses. In most instances, Medicare will be the primary payer when they use it alongside COBRA. In order to use Medicare and COBRA together, they would need to be enrolled in Medicare when their COBRA coverage begins. If they become eligible for Medicare during COBRA coverage, COBRA will end. Medicare and FEHB. FEHB signifies Federal Employee Health Benefits. Federal Employee Health Benefits are health plans offered to employees and retirees of the federal government, including members of the Armed Forces and United States Postal Service employees. Coverage is also available to spouses and dependents. While a member works, their FEHB plan will be the primary payer and Medicare will pay second. Once the individual retires, they can keep their FEHB plan and use it alongside Medicare. Medicare will become their primary payer and their FEHB plan will be the secondary payer. The amount their FEHB plan covers depends on the plan, but many plans will cover out-of-pocket expenses and additional services. Medicare and Veterans Benefits. A member can use their veterans benefits alongside Medicare. As a veteran, they have healthcare coverage through a program called TRICARE. Once the member reaches 65, they'll need to enroll in Medicare in order to keep using their TRICARE plan. Medicare and TRICARE work together in a unique way to cover a broad range of services. The primary and secondary payer for services can change depending on the services they receive and where they receive them from. An example would be TRICARE would pay for services received from a Veterans Administration hospital. Medicare would pay for services the member receives from a non-VA hospital. Medicare will pay the primary payer for Medicare covered services, and TRICARE will pay the coinsurance amount. TRICARE is the primary payer for services not covered by Medicare. Medicare and workers' compensation. Workers' compensation always pays first when a member is trying to use it alongside of Medicare. That's because workers' compensation is an agreement that an employer will pay medical costs if an individual is hurt at work. In return, the individual agrees not to sue them for damages. Since an employer has agreed to pay, Medicare will not pay until the benefit amount of the workman's compensation is completely spent. However, sometimes a workers' compensation case needs to be investigated or proven before it's approved. In this case, Medicare will act as a temporary primary payer. When the claim is approved, workers' compensation will reimburse Medicare. The member would also be reimbursed for any coinsurance or copayment that they might have made. Medicare and Medicaid. Medicare is always the primary payer when a member has Medicare and Medicaid together. Medicaid will then act as a secondary payer. Medicaid coverage depends on the state that they live in, but most state plans will cover the majority of their out-of-pocket costs. In some states, Medicaid plans also cover some services Medicare would not. So a quick takeaway regarding this lesson is that a member can use other health plans alongside Medicare. Medicare will generally be the primary payer, and their additional insurance plan will be the secondary payer. Secondary payers can help cover out-of-pocket costs and services Medicare doesn't cover. This concludes our video lesson today. I hope you found the information included helpful. Thank you so much for listening, and have a great day.